good. So I'm just gonna check out your fingers here. Do they hurt to touch?
No.
No, okay, sounds good. I am just gonna assess your pulse on your wrist. Equal and strong. And then I'm just gonna go up your arm here. Any numbness, weakness, tingling?
No.
No. And then to your hand?
No.
Nope. And then I'm just gonna go onto this one over here. Numbness, weakness, tingling?
No.
Nope. All right, sounds good. All right, Hannah, I know you need to be careful with this hand, but if you could try and squeeze my hand as best as you can. Okay, so you do actually have quite a bit of movement in that hand, which is good. I'm just gonna assess your capillary refill. Okay, great. I'm gonna take a listen to your lung sounds and your heart sound. Am I able to just open up your gown a little bit? All right. Just moving it to the side. So I'm going to be listening to your lungs first. Every time I put my stethoscope on your chest, I'll give you a cue to breathe. I just need you to be breathing in through your mouth and out through your mouth as well. And breathe in. Breathe in. Breathe in. Breathe in. All right, and I am just gonna go under your breast. Is it all right if I just move it up? Breathe in. All right, and then just one more point on the front. Breathe in. Sounds good. I'm just gonna listen to your heart sounds. All right, great. I am just gonna close your robe here. Are you able to sit up for me, Hannah? Okay, perfect. I am just gonna listen to your lung sounds on the back. I'm just gonna move your robe down your back. All right. If you could just take a big breath in for me. And then on the other side. Another breath. Another one. Another one. One more. All right, great. I am just going to feel your back for any lumps or abnormalities. Just let me know if you feel any pain. No pain or discomfort?
No.
All right, sounds good. I'm just gonna slide your robe back up. You can lean back for me. Okay, great. And Hannah, since you've been at the hospital, have you been eating about the same amount?
Yeah.
Yeah? And what does that normal look like for you?
About 3 times a day.
3 times a day? And you've been eating the full meal?
Yeah.
Okay, great. With that, have you been, what's the last time you went to the bathroom? When you did a bowel movement?
3 hours ago.
3 hours ago? And was that normal for you?
Yeah.
Yeah?
Regular.
Sounds good. And then how much water have you been drinking throughout the day?
A couple glasses.
Couple glasses, and that's around the normal range for you as well? And when's the last time you went to the bathroom to empty your bladder?
This morning.
This morning?
Mm-hmm.
And was that normal? Was there any pain when urinating? No discomfort?
No.
No different smells?
No.
All right, sounds good. So next I am just going to open your gown and listen to your stomach. Is that all right with you?
Yep.
All right. I'm going to move your shorts down as well. All right, so first I'm going to take a listen and then I'll feel around. All right. So Hannah, have you noticed any distension or any bloating in your stomach? No. All right. So just let me know if you feel any pain or discomfort when I'm touching around here. No pain or discomfort? No. All right, I'm going to close your gown again. Are you feeling any nausea or heartburn?
No.
No?
Today.
Any difficulty swallowing?
No.
No, nothing today? All right, sounds good. And have you noticed any swelling on your legs?
No.
No swelling on your legs?
No.
All right, I'm just going to check them out. Any numbness, weakness, tingling sensations?
No.
No edema on the legs. The other leg, any numbness, weakness, tingling?
No.
No edema on the legs. All right. Just gonna listen to equal and bilateral. Equal and bilateral. Capillary refill. And then Hannah, if you could just press down on my hands for me. Great. Then just pull up on them. Awesome. Perfect. All right, so before I leave, I just wanted to ask you a couple more questions. How are you since you have been admitted to the hospital? Have you been managed?
All right, I'm just going to begin by looking at your hair, looking for normal distribution and texture, which looks good. I'm going to feel both of your ears. I'm going to take a look at them, like symmetrical, normal, while I'm feeling your temporal artery. While I'm here, I'm also going to feel for your lymph. I'm assessing for any swelling, any pain, any tenderness. I'm also looking at the neck for any JVD, which is not notable. I'm going to feel the frontal and maxillary sinuses. And have you open your jaw for me, close it. Great. I'm going to have you stare at my nose, follow my finger. Great. Beautiful. And right at my nose. Pupils are equal, round, and reactive to light and accommodation. I'm going to look at her nose, which is also symmetrical. Look at the nares. Airways are patent. I'm going to have you open your mouth, stick out your tongue, say ah. Oral mucosa is pink and moist. I'm going to have you stick out your tongue one more time. I'm going to have you lift it up, down, side to side. Great. I'm going to have you give your eyes a tight squeeze. Good. Open them, lift up your eyebrows. Good. Can you puff out your cheeks, purse your lips? Give me a jaw clench. Great, and a big smile. Good. All right. Next, I'm going to place my hands on your chest. Deep breath. All right. Symmetrical expansion. I'm feeling for any fremitus, which there is none. I'm going to take a listen. Actually, disregard. I'm going to percuss first. Good resonance here. And back. Okay, good resonance there. I'm going to take a listen. Just listening to your breath sounds. Okay, now in the back. Have you say the word 99 for me?
99.
Again,
99.
again,
99.
again.
99.
Okay, there are no adventitious breath sounds. Lungs are clear. I'm actually going to listen to your heart now. I'm going to begin by listening with the diaphragm of the stethoscope. I'm going to listen again with the bell of the stethoscope. S1 and S2 were noted. Now I'm looking for any abnormal heart sounds. Okay, so there are no abnormal heart sounds. Here I'm going to feel for your PMI. I'm going to feel your temporal pulses, your brachial, your radial, popliteal, posterior tibial, and dorsalis pedis. Pulses are all palpable and present, and at this time I would check the other side and compare them as well. And lastly, you just have to listen to your temporal as well. There are no bruits, no abnormalities. Listening to your carotid. Also normal. Right. Now I'm going to have you lay back. I'm going to do an abdominal assessment. First I'm going to inspect, look for any visual abnormalities, which there are none. So I'm going to auscultate. Bowel sounds are present in all four quadrants. I'm now going to listen to the renal arteries. No abnormalities. I'm going to percuss. Making sure there's no areas of dullness, which would show enlarged organ. It's all resonant. I'm going to palpate. Any pain or tenderness when I'm feeling?
No.
No masses or abnormalities felt. Okay, while you're laying down, I'm just going to have you bring your heel of your foot up to your knee and run it down your shin. And on the other side as well. I'm going to have you bend you at the knee and then at the hip. Okay, bend at the knee, hip. Okay, and then you flex your ankle. If you don't let me pull you, press down the gas pedal. Okay. Lift your legs up. Don't let me push you down. Great. I'm going to have you sit up at the edge. Put your arms out in front of you. Don't let me push you down. Okay. Bend at the wrists. Great. Give me a squeeze. Bend at the elbows. Let me pull you. Good. Give me a shrug. Great. Can you bring your ear up? All right. I'm going to have you look down, back, left to right, side to side, that way. Great. All right. I'm going to have you stand up. I'm going to have you walk heel to toe. Okay. Can you walk on your heels and on your toes, tiptoes? You can come on back over here.
Neck. I'm just gonna look. You haven't noticed any lesions or anything like that? Okay, very good. Can you tip your head back and forward? Can you do it without moving your, very good, side to side and in a circle for me. Very good. So we have full range of motion. Our skin is appropriate for ethnicity. We have some facial hair, neck hair present, no lesions noted. Okay, so now I am going to just palpate and make sure that we don't have any lymph nodes, okay?
Okay.
This is our submental, submandibular. We have our pre and post auricular and occipital. Okay, and turn your head to one side for me. Okay, so I'm feeling here for the post cervical, our superficial cervical, and our deep tissue cervical. Other side for me. Okay, very good. We've got our post cervical again, superficial cervical, and our deep tissue cervical. Okay, and then right here, our supraclavicular. No lymph nodes noted. Okay, so now then, you'll just sit up for me. All right. I'm just going to listen really quickly here to your carotid. You can hold your breath for me. Okay, very good. You can breathe again. So our carotid arteries are both strong, equal, regular rhythm, and no bruise are noted. All right, so now we're going to move on to our chest for this part of the exam. I will ask that you take your shirt off if that doesn't make you too uncomfortable. We have the blinds closed and everything, so we are giving you some privacy here. Okay, so the first thing I'm going to do, have we had any chest pain, anything like that recently?
Well, like I was saying about my back,
Okay.
but it's not, doesn't feel like it's like inside or anything. It's kind of muscular.
Okay, no heaviness or anything like that. Okay, very good. So I'm just gonna, the skin turgor is good. I'm just gonna listen to your lungs now. Good, big breaths. One more big breath for me. Okay. I'm just going to put my hands on your chest right here.
Ooh.
Sorry, my hands are cold. One more big breath in. Chest expansion is symmetrical. Our lung sounds in the front are all clear, equal. No adventitious sounds are noted. I'm going to turn to your back. Do you think you can turn around for me? That way the camera can see. Sorry. Okay, perfect. Just going to do the same thing on your back. Can you sit up straight for me? take some deep breaths for me? Very good. Just a couple more. 2 more. And last one. Okay, our posterior lung sounds are the same. They are equal, clear, and no adventitious sounds noted. And one more good breath for me. My chest expansion is still symmetrical here. Very good. Okay, so now I'm going to have you stand up and just kind of bend over a little bit for me so I can look at your spine. Just bend like that. Perfect. Okay. Very good. We have the normal lumbar curvature with a mild S curvature. Okay, very good. You can stand up. Actually, you can sit back down. And the last thing we're going to do is we are going to inspect your breasts, okay?
Right.
So at home, it's a very good practice to get male or female to get in the habit of just being really aware and making sure, because you can also get breast cancer.
Yes.
It's not as common in men, but it is still possible. So some very easy techniques that you can use at home is you would do 3 different positions. I like to call it the rule of 3s. You do 3 positions. You lay down, sit up, and then stand up.
Okay.
And then you want to use your 3 fingers.
Yep.
And you're going to use 3 different kinds of pressure.
Okay.
And you would just go along right here.
Okay.
And you can practice that with me.
All right.
And you'll just want to go straight up, kind of like a line, to where you can feel if there's any lumps.
Yeah.
Very good. And so now I'm just going to perform just a small exam on you, and I'm going to palpate for lymph nodes and things like that.
Right.
Okay? So if you'll just... Good. Okay, on the other side, we'll do the same thing. You haven't had any tenderness or drainage noted?
No.
Other things that you'd want to look for at home, okay, you can put your arm down, would be different color changes. You would also want to look at your nipples and make sure that they don't have any color changes, and then make sure they don't like change to inverted.
No. They've been the same.
Okay, very good. And those are just things that you look for at home. He had no lymph nodes noted to his axillary, no tenderness, no discharge, anything like that. Okay, well, I just want to listen to your heart real quick, and then we'll do your, see how you're walking. You're not having any dizziness, anything like that? No recent falls or anything? Okay, perfect. So I just want to listen to your heart. So I've not done that yet. And then we'll be all done. Okay, very good. We have normal heart sounds, S1 and S2 noted. We got a regular